Hello, welcome to Congressman Brindisi's Coronavirus Tele-Town Hall. I'm Sarah Borman, Anthony's District Director, and I'll be your moderator tonight. Thank you for joining us this evening for an informative discussion with questions and answers about COVID-19. In addition to hearing from the Congressman this evening, we've got a few healthcare professionals and a representative from the U.S. Small Business Administration on the line to answer your questions. We're going to be starting the call shortly, but we'll let folks continue to dial in for a few more minutes. But so you know how to ask a question, the command you need to press is *3. That's *3 to ask a question. For folks just joining us, welcome. Congressman Brindisi's Coronavirus Tele-Town Hall. I'm Sarah Borman, Anthony's District Director, and I'll be your moderator tonight. In addition to hearing from the Congressman this evening, we've got a few healthcare professionals and a representative from the SBA on the line to answer your questions. If you'd like to ask a question, all you need to do is press *3. That's *3 to ask a question. We do anticipate that we'll be receiving a lot of questions this evening, and we're going to try to do our best to get through as many of them as possible. That said, if you don't get to ask your question, please hold on the line and leave a message, and we'll be sure to get back to you. We'll get started in just a bit, but just want to remind everyone that the way to ask a question is to press *3. That's *3 to ask a question. Welcome to folks continuing to join us to Congressman Brindisi's Coronavirus Tele-Town Hall. Thank you for joining us this evening for an informative discussion with questions and answers about COVID-19. In order to ask a question, the command you need to press is *3. That's *3 to ask a question. All right, so let's get started. I'd like to introduce Congressman Anthony Brindisi.
Well, thank you, Sarah, for hosting us tonight and moderating. I want to thank everyone who has joined the call tonight and taking time out of your evenings to hear a quick update on the coronavirus and what we're working on in Washington, but also be able to ask some questions and give some statements. I know, like many of you, I understand how scary this is and how desperate you are for answers, and that's why we're holding this event tonight. We want you to have answers to your questions, provide the information you need to protect yourself and your family, and give you the confidence that officials are doing everything we can to help keep our community safe. Tonight, you will hear from experts from Rome Memorial Hospital, SUNY Upstate Medical University, and the U.S. Small Business Administration. Now is the time for diligence. While health officials do their jobs, we all have a duty to do our part. Even those who are young and healthy need to consider the elderly and people with underlying health conditions. We are a community and rely on everyone to do their part, so it's important that people are washing their hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use hand sanitizer that consists of at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at higher risk of getting very sick. Cover your mouth and nose with a tissue when you cough or sneeze. Throw your used tissues in the trash and immediately wash your hands with soap. If you're not sick, you do not have to wear a face mask unless you are caring for someone who is sick. Face masks may be in short supply and they should be saved for caregivers. If you are sick, you should wear a face mask when you are around other people and before you enter a healthcare provider's office. Make sure that you clean and disinfect frequently, touch surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them and make sure to use detergent or soap and water prior to disinfection. I want to give you just a quick update on what's happening in Washington right now. You may have seen the news today, but the president signed the Families First Coronavirus Response Act. This bill was supported by Republicans and Democrats, and it will make sure we have free coronavirus testing, establish paid emergency leave, and gets critical emergency dollars to the counties across our district. In New York's 22nd district, there's approximately $33 million coming to the counties in the district who are on the front line really helping to respond to the public health crisis right now. I worked hard to ensure that all of our counties and our rural counties received the money they needed. And when politics in the Senate held up the bill, I worked with my friend John Katko, congressman from Syracuse, to call on the Senate to put partisan politics aside and pass the bill. As I said, fortunately, the bill passed at the Senate, and the president has signed it. But we know that the fight is certainly not over. In fact, experts are saying that it's just starting. So now I'm working with local governments, businesses, large and small, and members from both parties to make sure the next relief bill gets more resources on the ground, protects healthcare workers, supports our local economies and family farms, and takes into account our rural communities and schools. This legislation is still coming together, but I am all ears to listen to what your priorities are. I have spoken to farmers and business owners, school district officials and teachers, local governments, and much more to make sure that we get a bill that works for all of us. From the shores of Lake Ontario down to the southern tier and everywhere in between, I want you to know that we're in this fight together. The coronavirus knows no political party, and it's something we have to work together to address. As always, I'm here to serve you, so I will be listening to you and fighting for you in Congress. I want to just close my opening remarks. You may have seen the news today or read online that right now I am in self-isolation. I learned late last night from the attending physician in the House of Representatives that a member of Congress has tested positive for COVID-19. I had contact with that member of Congress late last week, and upon learning that he tested positive late last night, based upon the recommendation of the attending physician and my own doctor, I am self-isolating in my home for 14 days per the recommendations of the attending physician. So I want everyone to know that I am following CDC guidelines and the recommendations of the doctors, but I want you to know that our office is still here to serve you. I am teleworking from home. I am not exhibiting any symptoms currently, and hopefully it stays that way. But our office is still open and responding to emails and phone calls. So if you have the need, please reach out to us, and I want you to know we're still working on your behalf. So thank you to all of our experts who are joining us tonight. Thank you to Dr. Bushnell from Rome Hospital and Dr. Thomas from SUNY Upstate. I also want to thank Dan Rickman, who is the Deputy District Director for the U.S. Small Business Administration, who I think are going to be giving some opening remarks next, and we look forward to having your questions. Thank you.
All right, thanks so much, Anthony. Just want to remind everyone on the line, if you have a question that you'd like answered, just press *3. That's *3 to ask a question. Dr. Andrew Bushnell, Chief Medical Officer of Rome Memorial Hospital, would you like to give us some remarks?
Yes, thank you. As the Congressman said, we are all in this together. And Rome Memorial Hospital, like all of our other area hospitals, has been preparing for this situation for the last several weeks, if not months. At the current time, and using an abundance of caution, we have, like our other hospitals in the area, limited visitors and have started screening all patients, staff, and visitors who enter the front entrances that are open during the day. This is important because we want to limit the amount of exposure to our current patients, our staff, and the community that uses our hospital. So we want to tell you that we are prepared for this crisis that we're having. We hope that the spread of this virus is slowed down by the drastic measures that this state and this country are taking. And if we can slow the curve down, we can meet the need of the community and the public that we serve. I look forward to hearing some questions.
Thanks so much. Just a reminder, everybody, it's *3 to ask a question. Dr. Stephen Thomas, Chair of the Infectious Disease Division of SUNY Upstate Medical University. Would you like to give us a few remarks?
Thank you. Good afternoon. So I can tell you a little bit about how Upstate is approaching the problem, and it's very similar to how some of the other hospitals in the immediate area here are approaching it. So the first is that, of course, we want to continue to provide optimal care for our patients in our community. That includes not only people that are potentially suspected of having a COVID infection, but also those that have routine medical problems that are not related to COVID. The way we're doing that is we're enlisting the services not only of the groups in the hospital that normally provide care, but we have outfitted the primary care and ambulatory care network to the best of our abilities with the proper PPE and the proper testing materials so that we don't overrun our emergency departments and our hospitals. The second thing that we're trying to do, because it could be a game changer, is to try and get COVID testing capabilities here locally. And so we're pursuing a number of options to do that. The Wadsworth Lab in Albany has been outstanding. They have been getting hundreds of tests just from this region, and their turnaround time right now is about 1.5 days, which is really tremendous. We're also working with a lot of commercial partners who are now getting authorizations from the FDA to deploy their tests, and then we're also trying to bring that capability in-house to Upstate. Again, this could really be a game changer for us in turning what is now a multi-day process into a multi-hour process. The third is that we are really trying to take a very, very strict social distancing posture. So we have a very strict visitor policy. That's number one. Number two is we are trying to, whenever it's possible and feasible, to have people work remotely and telework. The third is that a number of elective procedures and medical visits that do not need to be conducted face-to-face, we are leveraging telemedicine platforms and just phone calls and things of that nature so that people don't have to come into the facility and congregate. We have a number of students. We have lots of researchers. Those people are not coming to work. They're not coming to school. They're being given remote learning capabilities, and we're going to handle it that way. And then the last thing is that we have to protect our healthcare workers, as was already mentioned. You probably see in the lay press a lot of discussion about personal protective equipment, or PPE, and the supplies of that. So we're working very hard to keep our supplies where they are so we can continue to protect our healthcare workers so we can care for our community. And that's it, and I look forward to questions.
Thank you so much. Just a reminder, everybody, if you'd like to ask a question, just press *3. That's *3 to ask a question. And our last guest, Dan Rickman, Deputy District Director for the U.S. Small Business Administration. Would you like to give us a few remarks?
Thank you, Sarah. Good evening, everybody, and thank you, Congressman Brindisi, for inviting us to be on this call. I just want to start off with discussing how SBA, we are nationwide continuing to assist small businesses with our primary mission of accessing federal resources such as working capital loans and counseling, and navigating their preparedness plans through certainly our office here in upstate New York and our 68 district office nationwide, as well as the numerous resource partners we have located across the country and in upstate New York. You may have heard recently that the president announced we are opening up economic injury disaster loans to certified states and counties, which would give businesses the ability to apply specifically for economic injury disaster loans to help them get through this difficult situation where they're probably not seeing the revenues they normally would, with the intent of giving them the tools they need to keep their doors open until we reach the point where their businesses can recover. Now, I'm very pleased to announce that just earlier this afternoon, New York State was declared statewide as an eligible SBA disaster area. So these loans are live, and businesses can access them from our site at sba.gov, where there's a tremendous amount of information about the coronavirus, generally what they can do to help their businesses through this time, but also where they can apply for these economic injury disaster loans for eligible businesses. So I'm happy to take any questions as we go through today.
All right, thanks so much. Friendly reminder to everybody on the line, if you'd like to ask a question, just press *3. That's *3 to ask a question. All right, I think we're going to take our first caller. Let's see. Gowrie?
Yeah.
Gowrie, can you hear us?
I sure
right.
can. Yeah, I guess my question was about the small businesses. I just heard that there are loans being given out. I know, like Trump said that small businesses that had to shut down, because it's basically required by the government, can get loans to pay their employees, right, for the next 2 weeks or however long this goes on. But a loan is something that has to be paid back, correct? So with what income are we expecting these businesses to pay back their loans?
Yeah, that is correct. So, this loan is designed to have flexible terms and very low interest rates, and it's designed to get you through this period. So, it's the existing tool we have within our toolbox within SBA's authority based on legislation. But again, these are designed to get you as best you can through this time period. So, specifically the difference between the revenues you would expect to receive at this time and that you're not, and the amount of cash you need to keep your doors open, maybe keep payroll, keep employees on staff, pay your fixed operating expenses, your mortgage, your insurance. All those things you need so that when we are able to ramp back up, you can do so quickly. And that's the idea behind the economic injury disaster loans. They're for working capital, essentially.
Now, I'll just add on to that as well. So this is Congressman Brindisi. So there have been two economic stimulus packages already that have been signed into the president, but right now there will be a third economic stimulus package that's going to be much larger than the previous two. The previous two really dealt with the immediate need with the public health response and making sure that workers who have to be out of work are covered through emergency leave, but also getting funding for free testing and money to our counties to deal with the public health crisis. I think going forward, what we're going to see and what the president has been talking about, as well as leaders in Congress, is a much larger economic stimulus package that I hope and am pushing for more immediate, direct financial payments to individuals, bridge loans to help keep small businesses afloat that have low to zero interest loans, flexible dollars that we can get out to small businesses to be able to keep them afloat as soon as possible. Because, I heard a study recently, there's something like 30 million small businesses in the country. 24 million of them are sole proprietorships, and on average, they only have about 27 days of cash flow to keep them going. So we need a large economic stimulus package now. We need to get cash out to these small businesses and the workers who are most affected by these shutdowns, and that's what Congress and the White House are working on right now.
All right, thanks so much. Just a reminder, everybody, *3 if you'd like to ask a question, star 3 to ask a question. Speaking of, let's take our next one. We've got Roy from Endicott. Roy, can you hear us?
Yes, I can, loud and clear.
And you've got a question?
Well, my question was, I'm about nearly 70 years old. I'm retired, and I'm now driving a Medicaid taxi for a taxi service. And all we do is transport people to appointments, doctor's appointments, stuff like that, every day, all day. And all Medicaid patients, and a lot of them are sick. And I do clean the inside of my taxi out after every person I pick up, after I drop them off with sanitizer and et cetera, et cetera. Is there any other precautions I should take?
Roy, this is Dr. Bushnell. Great question. I mean, you are, because of your age, you're a person at increased risk for a more serious disease course than the rest of the population, right? We talk about COVID-19 affecting some of our older individuals in the community, those greater than 65, with a more severe course of illness, and those that are immunocompromised or have other comorbidities such as heart disease or respiratory illness. So you're at an increased risk for a severe illness course if you get the disease. You probably should consider whether or not this is a line of work you are going to continue during this time when this disease is going around as a pandemic. There's really not a way that you can not breathe the air that someone might be emitting in your small car, so that you're driving. You're in an enclosed environment, so this is a risk for you. We have to take into consideration, as we're looking at people who are coming to the hospital and coming to appointments, what should the public do right now? We have patients who, are experiencing moderate to mild illness. They might have fever, cough, and shortness of breath. They should call their healthcare provider, but they should not run into the emergency departments, and they should not run to the urgent cares, and they should not show up unannounced at their primary care offices. They should call their provider and discuss what to do with their symptoms, and if they're severe enough, if they're having respiratory distress, that is the time that those individuals should present to the hospitals to be seen. But in your case, what you're asking is, should you participate as a Medicaid cab driver and be exposed to these individuals? That's something that you're going to have to balance because you are at increased risk based on your age.
Hi, sir. This is Stephen Thomas. So I would recommend that you don't do that activity anymore. As was mentioned, you're at risk, and in terms of a social distancing policy, not only is it being violated by doing that work, but it's also you're taking the highest risk population for infection and putting it within 3 feet of you. And so I would really strongly advise you to see if there's another way to be of service and not do that for the time being.
Thank you both so much. Just a reminder, everybody, if you'd like to ask a question, it's star 3. That's star 3 to ask a question. So let's get another question on the line here. Al? Al, can you hear us?
Yes, I can.
All right, you've got a question?
In regard to the fact that we've been told countless times about touching the surfaces and washing our hands and so forth, my question is, what about the fact that we are constantly being delivered mail, newspapers, going to the stores, touching products that have already been touched? How susceptible are we to that?
That's a very good question. So this is Stephen Thomas. So it really is. Unfortunately, we're really not able to really accurately quantify what that risk is. So the risk of touching, surfaces, whether they be metal or cloth or paper or cardboard, in kind of high traffic areas like supermarkets, for example. So really the only thing that we can advise is that, and this is, my personal opinion, wash your hands before you go in. Do your best to not touch your eyes, your nose, your mouth, or your face while you're in one of these areas. Get what you need to get back out, and then wash your hands again.
All right, great. Thank you so much. Just a reminder, it's *3 to ask a question. That's *3. And let's take a question from Tyler from Afton. Tyler, can you hear us?
I can hear you. Good afternoon, Congressman Brindisi. Good afternoon, doctors.
You too. Thank you.
Good afternoon.
Congressman, you and I have gone around on Twitter a couple of times, but this question is more toward the doctors. I've been seeing some interesting news stories on COVID and how it affects people who smoke/vape. My mother smokes, I vape. How susceptible are we to this, and how true are those articles stating?
Well, I think that you have to consider if your family member has COPD and, from smoking for a long period of time, and if that condition, how bad is her condition? If she has a respiratory condition that's chronic or needs oxygen, she's at a much higher risk of severe illness and or mortality from this. For someone who just smokes, you may be, at a slightly increased risk for a more severe course of illness. But certainly as our individuals who have COPD and worsening respiratory disease, and then they get a respiratory illness, whether it's flu or whether it's COVID-19 or any other respiratory illness such as pneumonia, they're at an increased risk of morbidity and mortality from that.
All right, thank you so much. Just a reminder, it's *3 to ask a question. That's *3. Well, let's get another question. We've got Lori. Oh, I'm sorry, I'm reading that wrong. Laurel from West Winfield.
Hello?
Laurel, can you hear us? All right.
Yes, I can hear you. My question is in regards to something I saw on the news this evening. It said that 213 people have been tested in Oneida County, but then they went on to say that 223 people are under mandatory quarantine and 81 are under precautionary quarantine. So I'm wondering what the criteria is between the two quarantines, and how do you meet criteria for testing, and how many tests we have available for these people?
So the type of quarantine in Oneida County is determined by the health department, and it's based upon your exposure and your travel history, and that's based upon the county's health department's assessment. Your other question, which talks about the number of tests available. Of recent note, hospitals have been running out of or coming close to running out of testing swabs. So, if someone presents to the hospital and is relatively healthy and has mild to moderate symptoms, we are not going to test you. There is not enough tests and not enough testing materials right now to test you. And the test, as an emergency medicine physician, you really don't run a test unless you're going to do something with that test, right? So if I choose to do a blood test or a lab test, I want a result that I can act upon. Right now, the COVID-19 test doesn't give us an option to treat because we have no treatment. We have no vaccine, and we don't have a treatment if you have the disease. So if you are mild to moderately sick, we're going to send you home, tell you drink plenty of fluids, stay in quarantine for 14 days, and try and get better. Now, we want to save the tests that we have for those people who are of more severe risk profile, those elderly folks, those immunocompromised people that we want the health department to check on routinely, and for those patients who are in the hospital, because it may determine how we address those individuals with what types of PPE, what types of personal protective equipment we have available to us in the organization. As the Congressman said earlier, we are utilizing PPE as we get it. Every hospital is garnering and watching how much personal protective equipment they have for their staff and using appropriate PPE. We have heard of situations in other nations and in other hotspots in this country where personal protective equipment is not readily available for hospital staff, and we want to make sure that we protect the staff so they can take care of that patient with COVID-19 and also not spread it to other patients who have other reasons to be in our organization. As the other physician, Dr. Thomas, mentioned, we don't want patients to not come if they're having strokes or heart attacks or other serious illness. We want to be able to serve all of those patients that we routinely serve now and take care of this new threat to our public health.
So this is Stephen Thomas. So, I agree with a lot of that. A test is used to support decision making that a physician has to make, and so no test makes the diagnosis on its own. So we will only test somebody for the virus that causes COVID-19 if they have a clinical picture which is consistent with the disease. And part of our process here is that there are still common things that are still circulating. So there's lots of other viruses that can cause colds and pneumonia, and there's still influenza circulating. We have influenza in central New York up until late April. So when we see somebody that has an illness with fever or severe fatigue or muscle aches, and they just don't feel well, or they come in and they have fever with a respiratory syndrome, so cough or shortness of breath, we will try to first see if we can make a diagnosis of something that, at least at this point, is still a little more common, like influenza or another viral infection. And if in the process of making that assessment it's determined that we don't have a diagnosis, it's at that point then that we will make the decision whether to test that person for COVID or not. Because as was mentioned by Dr. Bushnell, the access to testing and the materials that you need to actually perform the test, they are a finite resource right now. It's not a limitless resource, and so we have to be very careful who we test, and we have to make sure that the results of the test is going to be actionable.
And I'll just add to that too. This is Anthony Brindisi. This is a big concern of mine. I've been hearing about shortages of testing equipment and personal protective equipment and face masks all across New York State. And unfortunately, it's not a problem that's unique to this area. It's happening all across the country. I have a sister who is a infectious disease nurse at a local hospital, so I've heard from her, and it's a big concern. And I have been tracking this. We've been getting reports from local officials as to where the shortages are. I have spoke to my staff, and we have forwarded that information off to the U.S. Department of Health and Human Services to let them know about where the shortages are in our area. Unfortunately, and this is a longer-term problem that we have to deal with in this country, a lot of this personal protective equipment and the masks and things like that are made overseas in China. I was talking to a business owner here in the district yesterday who makes the protective gowns, and he said that 99% of this stuff is made in China. He's part of the 1% of companies in the country that actually makes this still. That's unacceptable. Going forward, if one thing we take away from this crisis is that we have to have these supply chains back here in this country. We can't have one of our adversaries like China control all of this material, because God forbid we ever went to war with China, they could just hold off on all the supplies, not only protective equipment for healthcare workers, but pharmaceuticals and other things like that. So we have to bring this manufacturing back to this country. This is a longer-term issue I'm committed to working on, because we need to have a supply of this stuff in the event a crisis like this happens again.
All right, thank you so much. A reminder to everyone on the line, if you'd like to ask a question, it's *3. That's *3 to ask a question. So let's take another. We've got Rebecca.
Yes.
Rebecca, can you hear us? All right.
Yes.
Do you have a question?
Yes, I have a teenage son, and I also have severe asthma myself. And I have read different things online saying that teenagers could congregate in small groups safely, and I wanted to know if that was still accurate or if it's best to remain inside the home.
So this is Stephen Thomas. So I think the location is less important than the social distancing aspect to it. What I mean by that is, so, you know, I've gotten this question a lot about children, and of course it applies to teenagers. Although, and as Dr. Bushnell already mentioned, although there is a certain demographic that seems to do much worse with this disease than another, I think it's pretty clear that anyone can be infected with the virus that causes the disease, COVID-19. And we know that children can be infected. We know that they seem to do better with the disease than adults do, and although we don't have a ton of data on this yet, I think it is safe to assume that they can also transmit the virus. And so any kind of congregating between people, if someone is infected, they will be able to give it to another person. That other person, they may not become ill, but they could come home and they could infect somebody else. And so the idea is, with social distancing, is to try to reduce the number of opportunities for one person to infect another, and then that person to then infect somebody else. So I think while people are social distancing, it makes sense that people would make their home base per se, but but do they need to stay in the house 24 hours a day? No. Can they go for a walk or go to essential places that they need to go and get gas or pick up their medications or whatever it is? Sure, but it is the avoidance with people outside of the family unit that is really kind of the focus of this. And I don't know, Dr. Bushnell, if you have more to add to that.
Yes, thank you, Dr. Thomas. As a parent of 2 college students and 1 senior in high school who are all home because of the school closures, they're on lockdown. They have, the ability through our current electronic age to FaceTime their friends. They have the ability to turn on Netflix and reunite each other as siblings to one another, but they are not socializing with their friends outside the house, and their friends are not coming to our house. We are basically isolating from other families. Now, they can go outside and they can do things outside, but it is, when I say outside, it's but with their siblings, not with friends. They're outside of our house on our yard, and their friends are somewhere else. We have kept that distance because, strictly speaking, we don't want to give or receive the virus from other families. This is social distancing, as Dr. Thomas put it. This is how we all stay safe. So I would say, your child should not be socializing with other children from other families. They should stay home, or she should stay home. They can FaceTime those other folks and do their socializing over electronic media.
All right, great. Thank you so much. Just a reminder, everybody, it's *3 to ask a question. That's *3. Well, let's take another question from Trisha from Oswego.
Oh, here we go. Hello, how are you? Yes, hello. Oh, I'm doing okay. My question is, yes, my question is, I am also a medical transporter here in Oswego County, and I am not in the older age range for being higher risk, and I take every precaution that, I know of to take. My concern is that here in Oswego County, the news says that there's no cases of positive corona, but I have it on good authority that there are. So I'm not feeling too sure about how safe I am continuing to do medical transport. But I can't exactly afford not to work either. So I'm just wondering what the situation is for people like myself.
This is Stephen Thomas. I think this is a really, really important question, and it is also a question that we get from the medical staff that work in our ambulatory clinics or the medical staff that work in the hospital, and I think it really brings home the fear or the concern of the unknown, right? There's so much that we don't know about this disease and how the virus is transmitted and the risk of getting infected, et cetera. So I do understand the question that you're asking. So I would say this: have you been able to speak with your employer to express these concerns and to ask what kind of provisions the employer is willing to make to protect you so that you can do your job, which, by the way, is a very vital job, because another side point I can tell you, we have patients that rely on public transportation, or they rely on Uber or Lyft or these sorts of things to make it back and forth to the hospital, and there are anecdotal stories of people not wanting to pick them up and transport them. So the role that you play is vital, and I'm just wondering, have you been able to speak to your employer and ask what they can do to help protect you?
I'm not sure if she's still able to back and forth with us with this process.
Yeah. So please go ahead.
Oh, sorry. This is Dan with SBA. So on the outside chance, and I was going to ask a clarifying question, if she was a sole proprietor, I can't address the employer question. This might be an example of if she is operating a business as a sole proprietor, whether she has one vehicle or 5. A function of our economic injury disaster loan program is to really address the losses very specifically that are causing these people to not meet their ordinary financial obligations. That includes, making a living to a certain extent. So, if you're still listening, ma'am, I would encourage you to, reach out to, SBA. You can visit our website, sba.gov/local-assistance to get our contact information. So I'll say that one more time, sba.gov/local-assistance. And we can provide you, a little bit of more of a tailored response, and to see if this is something that might meet your needs.
This is Dr. Bushnell, just thinking a little bit outside the box here. You're exposed to a good number of patients from a healthcare institution on a routine basis because you're doing that sort of transport work. And though a mask might not protect you, the concern I may have is that you may be exposed at some point in time, and then you may be a transmitter to other patients that you might have in that vehicle. Whereas a simple isolation mask, surgical type mask, might help you not transmit COVID-19 to other patients that you're carrying inside that vehicle. So for the sake of not being a transmitter yourself, it might be needed that you wear a mask, thinking that you might be already exposed.
All great suggestions. Thank you, everybody. Just a reminder, it's *3 to ask a question. That's *3. And let's take another one. We've got Danny from Broome. Danny, can you hear us?
Yes, hello.
Hi, you've got a question?
Yeah, I'm a property owner. I rely on the rental as income, and it's been on the news that they may waive the rent, tenants' rents, and possibly also waive mortgages, which I do have a mortgage on the rental property. Is there anything I have to do to enact that?
Well, I can talk a little bit about that, Danny. Those are some of the proposals that are being considered right now in Congress and being talked about as part of a third economic stimulus package, allowing individuals and businesses to defer mortgage and rents, other types of loan deferral programs. Nothing is set in stone right now because these are part of ongoing negotiations, but we can certainly keep in contact with you if you keep in contact with our office and get you information as the stimulus package comes together to let you know how you can react to it.
Great, thank you. Just a reminder, everybody, it's *3 to ask a question. That's *3. And so let's take another. We've got Monica from Oneida. Monica, can you hear us?
Yes.
All right, you've got a question?
Yeah, relating to the family and individual stimulus, kind of goes with the business stimulus. I know there's been talk about family and individual, but also with the businesses, if it's fewer than 50 employees, how would they get paid time off? And then is there something in effect for just family and individual stimuluses? And I also have another question after that.
All right, go right ahead and ask that last one too.
Okay, and the other one's for third-party contact. If somebody I've been in contact with, but I haven't been in contact with the other person, but they have that tested positive for corona, do we self-quarantine and how long? And is there chances of repeat coronavirus?
This is Stephen. I can handle the second one, but should we go with the first question first?
You can go with if you want to go to the second one first, talk about the secondary contact, that'd be great. Then I can talk about the small business, and if Dan wants to weigh in too there, we can do that.
Okay. Yeah, so we get this question a lot as well, the secondary contact. So really the guidance that is out there is, so I'm talking about departments of health and CDC and World Health Organization. That guidance is really geared towards what do you do if you have contact with a known positive patient, and so or contact with someone that is known to have been infected, and then you're going two steps beyond that. So to have and so there really is not great guidance on being, or any guidance for that matter. So it has to be kind of extrapolated. What I can tell you is my personal opinion, and my colleagues here share the same, and I'm interested in Dr. Bushnell's opinion. You should basically, you're really at an incredibly, we can never say zero, but an incredibly low risk if you are the contact of a contact. What we would recommend that you do, no need for self-quarantine. You should just sort of monitor yourself for any potential symptoms. If you do develop any symptoms, you should speak to your healthcare provider, and that period of time that you kind of do that self-monitoring would be what the accepted incubation period is right now, which is about 14 days. I don't know if Dr. Bushnell has a different opinion or...
No, Dr. Thomas, I agree completely. I think that you're probably more at risk from the people that you've contacted that you don't know if they've been sick or not, or they haven't been sick yet. I mean, you're so far removed from the index case that you're discussing that your risk is very, very, very low. And, all of us don't know who we contact on a daily basis and who is shedding virus in those, days, 1 to 2 days before they show symptoms, because there is a virus shed rate that happens before we show symptoms. And those are the people that, potentially could infect us that we don't even know. So I think your risk is very low. I'm interested in Dr. Thomas's answers to the final question that this caller had, which is, what is the chance of being reinfected once you've had it?
Yeah, it's a great question, and we unfortunately don't know the answer specifically at this time, but we will eventually. There is information coming in from animal experiments, which basically show that once an animal is infected, then they seem to develop an immune response which would protect them. We do know that the community acquired coronaviruses, right? So the 4 coronaviruses that have been around since the 60s and cause about 30% of the common colds each winter. We do know that immunity to those can wane over time, and people can be reinfected with those. But the coronaviruses that are more like COVID-19, so SARS and MERS, that's a different scenario. And my personal opinion is, I would expect that there would be immunity once if you were infected, and that to be reinfected, at least in the near term, would not be possible.
Dan, do you want to talk about the small business question, or?
I'm sorry, I'm going to admit that I missed the small business component of the question. I'm still in the office. We got folks coming in and call, believe it or not.
That's okay. I can give you I'll give a quick summary of what was passed in the Families First Coronavirus Response Act. And then if I don't answer your question, the caller, I encourage you to just reach out to my office. We can get you more detail on that. But essentially, there was a paid sick leave that was passed as part of the coronavirus bill. So employees at companies with fewer than 500 employees, eligible full-time employees are entitled to 2 weeks, 80 hours of fully paid time off, up to $511 per day, to self-quarantine or seek a diagnosis or preventative care or receive treatment for COVID-19. Also applies to part-time employees as well as small businesses under 50 employees. But if you do have questions about that, if you're either an individual or a business, it is funded fully. The way it's reimbursed to the employer, it's a refundable payroll tax credit that works like this. The employer that is subject to the mandates pay their employees according to the mandates requirements, and then they are allowed a 100% credit against any wages they pay pursuant to the mandates. But again, I encourage you to reach out to our office. We can get you a summary of what's in that particular legislation so you can know how to plan for your business.
Yeah, and thank you, Congressman. I can't address the simple financial components of that in terms of
sure.
There's an additional expense, right, to the business, and if a business is already I'm talking purely from a cash flow perspective, because that's the type of loans we're talking about here when we're talking about our economic injury disaster loans. And if you don't have sufficient cash flow, within your current operations due to this disaster, this is also something that the we call them EIDL loans, the EIDL loan is able to make up the difference for.
Great. Thank you, everyone. Just a reminder, it's *3 to ask a question. That's *3. Let's take one from Carrie in Homer.
Hi.
Carrie, can you hear me? Hi.
I can. Currently, my parents are in Morocco, in Casablanca, and all their flights going out were canceled. They are unable to get a flight. I'd like to know what's being done to get Americans overseas home.
Well, I can address that. So, Carrie, this is an issue that was actually brought to my attention today by another member of Congress who has constituents that have family members that are stuck in Morocco right now because Morocco is not allowing anybody in or anybody out at this point in time. What I would do is I would encourage you at some point tomorrow, or if you can stay online afterwards, contact our office. We have someone on staff who handles all of our immigration issues, and we can certainly work with you and try and help whatever we can to intervene with the State Department and see what we can do to get that person home. We were talking about this. I was actually talking, as I said earlier, to other members of Congress who've been hearing the same issue, and I think one of the things we're going to try and push for is perhaps some kind of a chartered flight or something to be able to get Americans who are stuck there back home. This may be happening in other countries as well. We'll see as the days go on here, but it's a big problem, and I definitely understand it. And we will work with you. Just reach out to my Utica office, and we will work with you to try and see what we can do to intervene with the State Department to get them home.
Great. And just in case anyone needs it, our Utica office number is 315-732-0713. I'm about to take our last question, so if you didn't have a chance to ask your question, remember you can stay on the line and leave a message, and we will get back to you. So for our last caller, we've got Chad from West Winfield.
Here we are.
Chad? Can you hear us? Chad Tangora?
Yes.
Hi, you've got a question?
Yes, my question was, do you see this peaking anytime in the next week or two or month before the cases start going back the other way, we start getting back to normal? And how much more severe is this than the regular flu?
Hi, this is Stephen. So, so that's a good question. I can give you some context on that. So, right now there's as of an hour ago, been documented about 242,000 cases in the world, and about 9,800 people have died. That's a case fatality rate of about 4%. In the United States, we've had over 13,000 cases with around 175 deaths. That's a mortality rate of about 1.3%. In New York, we're around 5,300 cases with around 22 deaths. So that's a case fatality rate of about 4.4%. Influenza has a case fatality rate around 0.1 to 0.2%, and that kills between 35,000 and 40,000 people every year in the United States. So even at the lower estimate, which is what we're getting in New York right now, 0.4%, that's still 4 times more fatal than what we know about SARS-CoV-2, which is the virus that causes COVID. In terms of the question about the peak, so if we were to do nothing, so no social distancing, no attention to personal hygiene, whether it be hand hygiene or respiratory hygiene, all the things that the Congressman talked about earlier in the show, then we would be far away from reaching the peak of this epidemic. What we're trying to do is to make that peak lower, so in terms of the total number of cases lower, so that we can stay below the capacity of our healthcare system. And what places like South Korea, which is really a success story, the types of things that they've been able to do to decrease the mortality that they have seen and to really, again, flatten the curve. It's a term that everyone is using now, but it's really relevant and it's a good visual. Has been a very aggressive social distancing policy. It has been access to testing, which has been a challenge in the United States, getting better but remains a challenge. It's been really good sort of what we call MPIs, non-pharmacologic interventions, so things other than medications and vaccines like social distancing, like washing your hands, like making a diagnosis so that the Department of Health can speak with that person and find out who they may have been in contact with and then speak to those people. So I can't answer your question, but I can tell you it is within our power to try and impact what the answer is. And so I'll leave it there and then ask Dr. Bushnell for his comments.
Right. As an emergency medicine physician, I don't think that we're going to see this peak in 4 weeks. I think it's going to go much, much longer. As Dr. Thomas mentioned, the curve, when we talk about this curve, if we don't do anything, each person that's infected infects 2.2, 2.5 other people every single day. And so exponentially, the number of cases grows and grows and grows, and it overwhelms the entire healthcare system. So that's why the policies that were put in place to create social distancing hopefully impacts that number of people that each infected person can infect. And therefore, we slow the growth of the epidemic, and we allow our healthcare system to be able to accommodate the individuals that we see. As I mentioned earlier, we want to try and limit who comes to the hospital and who comes to the doctor's office to those that are truly in need, because there is a limited resource. And we're there for those folks that come in, but we want to make sure that we have enough personnel that are not ill taking care of the patients, and we want to make sure we have enough supplies to take care of the patients as they arrive. The stories from Italy are grim. The stories from Italy make us understand that if we don't do something to slow the trajectory of this process, we will, reach a maximum point where we can't take care of the patients that are ill, and Italy has that problem. By doing the social distancing, it does stretch out that peak. So, what would normally peak probably in a month or two will probably take longer to peak, because we're stretching that curve farther down in a timeline, and allowing our other partners, our pharmaceutical partners, our private entities to hopefully find a treatment during that time that may impact how we take care of sick patients in this country. So there's other benefits of stretching the timeline along a little farther and slowing down the spread of this disease process so that we can get others to take some time and create the cure, or something that at least helps us treat the disease process and makes it less severe. Now, I do want to point out one thing. As an emergency department attending, we see all types of disease processes, which include trauma victims, which include people who, need blood products. And I do want to stress that the nation's blood supply is safe, that if you need blood, it is clear of coronavirus, and that our American Red Cross centers desperately need donations. So, we need to remember that donating blood is something that we can do to help, and that they have created those donation centers with social distancing in mind so that they are safe to go to and donate and leave, and that's important.
This is Stephen. That's a great point, and I'm not authorized to talk about the date, but I will tell you, please follow the newspaper and radio and TV, because there are blood drives that will be going on, and blood is desperately needed.
Thank you both so very much. That's all great information. Anthony, did you have some final thoughts?
Yeah, thanks, Sarah. Thank you for moderating, and I want to thank everyone for joining us tonight. I really thought we had some very thoughtful questions. I know we had a very high number of calls, and unfortunately weren't able to get to everyone. But if you stay on the line, you can leave a message, and we will get back to you. If you have any questions or you need any assistance, please feel free to call my office. I'll give you that phone number. It's 315-732-0713. Again, 315-732-0713. We are here to help you. I want everyone to know that we're in this together. It's all hands on deck right now, but we are going to get through this just like we got past 9/11 and we came together as a country. We are going to get through this crisis as well. I want to thank our experts. I want to thank Dr. Bushnell from Royal Memorial Hospital. I want to thank Dr. Stephen Thomas, who is the chair of infectious disease at SUNY Upstate Medical University. And I want to thank Dan Rickman, who is the deputy director, district director of the U.S. Small Business Administration. And thank all of you who are here. Our experts, I can tell you your work is so important, what you're doing right now, and we just appreciate so much what you are doing for our community right now. Thanks, everyone, for being on, and we will be holding more of these in the future, so please stay tuned. Thank you all, and have a good night.